It's called Pectus Excavatum, a chest wall malformation that affects 1 in 400 children.
There's a full spectrum of different types of congenital malformations. The majority don't need surgery.
But if the condition worsens as the child grows, it can cause difficulty breathing and compression on the heart and lungs.
I was scared because if I didn't do the surgery, I could have heart problems in the future, and so I just thought the best thing to do would be surgery.
Jake Knutson had his first surgery when he was 10. Now 13, the symptoms have become worse, making him a good candidate for the surgery.
He is the perfect candidate for the minimally invasive repair of Pectus Excavatum, which is a thoracoscopic procedure that we do, minimally invasive, that allows us to insert a stainless steel bar behind the sternum that pushes the sternum out, and it corrects the caved-in deformity of the chest.
Pediatric surgeon Dr. Hebra uses a surgical technique called cryoablation to minimize the pain during and after the procedure.
That allows us to numb up and freeze the intercostal nerves. So during the procedure and after the procedure, the patients have minimal pain because those nerves are blocked,
offering patients like Jake a quicker and better recovery.
It'll be nice that it's fixed and normal.
For Lee Health, I'm Lindsay Morton.